site infection. CDC defines it as an infection that occurs after surgery in the part of the body where the surgery took place. There are 3 classifications. There's superficial, there's deep, and there's organ or space. These infections can be diagnosed within 30 days after the procedure or 90 days if you have an implant. For superficial infections, it involves the subcutaneous tissue. Usually you have pain, swelling, redness, maybe have a little bit of drainage. For a deep incisional, it's a little bit deeper, obviously. It'll involve tissues such as the fascia and the muscle. Again, the patient may have redness, fevers, pain, and there may be an abscess present at the site. Your organ or space infections will involve the organ that was the surgery was performed on, and if they have a drain, you may see pus coming out of the drain. So, as far as the numbers go, there are approximately 160 to 300,000 SSIs each year in the US. It's the most common hospital-acquired infection, and about 60% of these are preventable. These infections are costly, not only to the patient and healthcare system, they're also the potential to be deadly. Here at this facility, we had 35 last year across all specialties. This year we have approximately 23, and we've seen the majority of them in neurosurgery. So should an SSI occur, it could add an additional 7 to 11 days of hospitalization for that patient. There is a 2 to 11 times higher incident or risk of death for that patient, and they account for $3.5 to $10 billion in healthcare expenditures each year. The hospitals see a decreased reimbursement for SSIs. There are a bunch of risk factors. They can be patient-related. This includes comorbidities such as diabetes or obesity. Age also plays a factor. Smoking status, nutritional status. Are they taking any immunosuppressive medications? Procedure-related would be skin prep, hair removal, the length of the surgery especially, and how much traffic there is in the room. That can also be a factor as whether or not the air currents are stirred up. So what do we do as providers? What can we do? Well, some of these we already have in place. We have skip protocols, we have patient care bundles. These protocols make sure that we're doing things such as, are we giving the correct antibiotics? Are we giving them before the incision? Hair removal, are we using the clippers instead of the razors? Blood sugar especially. We want to keep the patient from experiencing hyperglycemia. We also want to keep the patient warm. But today we're going to start with some basics. Let's start with hand hygiene. What's wrong with this picture? Yell it out.
All the jewelry on.
Jewelry?
Pelicanus's coffee cup.
Yes, yes. He was probably here before the scrub went out. Anyone else?
Front of the scrubs are all wet.
Yep.
Something funky's going on under the sink there.
It is lotion, yeah. I guess, yeah, it is. All right. So yes, the scrubs are wet. They're wearing jewelry. The nails are too long. Not only that, they're wearing chip nail polish. And they're using an unapproved lotion. Hand hygiene should be performed when you take the gloves off, when you touch the patient, after you're exposed to any body fluids, after touching something like the patient's stretcher, and especially after you're eating, after you use the restroom, or if your hands are dirty. Simple enough, right? Hand hygiene, it's pretty simple. How do you do it? Take your jewelry off, soap and water, scrub your hands together for 15 seconds rather vigorously, rinse them and dry them. Or use an alcohol-based hand sanitizer, that's also acceptable. So let's cover some basics that's specific to the OR. Surgical attire. Hats should be worn. They should cover the hair, the ears, and for the guys, sideburns. Also the nape of the neck. Your scrub attire should be clean. You should be wearing a jacket, long sleeve jacket over top, and it should be buttoned closed. ID badges should be visible, worn and visible at all times. And you should have dedicated shoes just for the OR. Also, one very important thing, whenever you leave the OR, a white jacket should be worn. It can be cloth, it can be disposable, but it should be worn outside the OR at all times. Your scrubs, you don't want to take them home, you don't want to wear them from home, you don't want to clean them at home. Facial hair for the guys has to be covered. Fabric hats can be worn, but they should have a covering over top of them. Masks, and I've seen some people do this, masks should cover your nose and your mouth. I'm guilty as much as some people around here. They should not be worn around the neck and worn in the halls. You should be taken off when you leave the room, and masks should be fresh for every single case. Your nails, you want to keep them short, about 2 millimeters in length. You can wear regular nail polish, but gels and acrylics are not accepted anymore. So let's talk a little bit about aseptic technique. Aseptic or sterile technique is the use of specific actions and activities to prevent contamination and maintain sterility of identified areas during operative or other invasive procedures. This right here, ladies and gentlemen, is our cornerstone. This is what we strive for. This is how we decrease our microbial contamination. So to start, members of the team who are going to be scrubbed in, this is how we scrub. Very similar to our regular hand hygiene, but a little more intense. You want to remove your jewelry, put a mask on. Wash your hands. Use a nail pick for every case. Choose your scrub solution, scrub in, rinse carefully, and then dry with a sterile towel. Two different methods of scrubbing. You have your count and stroke method, and you have your timed method. For those who are trained as scrub technologists, this is a little more familiar than it is to you than it is to me. So, count and stroke method is just that. You count how many times you scrub each area of your hands and arms. Timed method, you can do a 5-minute scrub, which most people do at the beginning of the day, or a 3-minute scrub. Gown and gloves. Your gown should be opened at an area away from your back table, because you don't want to open your gown on your instrument table and then walk over with your hands wet and drip on the table. The front of the gown is considered sterile from the chest to the level of the sterile field. Your neck, your shoulders, and your armpits, not sterile, neither is your back. For draping, sterile drapes should be used to establish a sterile field. When you're opening, you should always open toward you and then away from you with sterile drapes. So the scrub should not be leaning over an unsterile area. And once they're placed, they should not be moved. Sterile field should be constantly monitored. There should be someone in the room at all times to watch that sterile field once it's established. If there is a break in sterility, it should be corrected immediately unless it is unsafe for the patient. So if an instrument gets contaminated, throw it off. And AORN is now saying that if the sterile field is not going to be immediately used, it can be covered. Skin prep. For patient skin prep, you can either have a scrubbed or an unscrubbed member of the team perform a skin prep. If an unscrubbed member does perform the prep, they want to clip the hair, or if it doesn't require it, you don't have to clip the hair. They want to make sure their arms are covered, so they're not shedding any skin or hair on the patient. They want to use sterile items to prep. When you prep, you want to prep wide. Start from the incision site and work your way out. When you reach this periphery, use a new applicator. Either be a ChloraPrep, or if you're using betadine, use a new betadine soap sponge. Always start from an area of low contamination and proceed to high. Prevent pooling of the solution and allow a dry time. And that's according to manufacturer's recommendations. When you open a sterile item, you want to make sure that the package integrity is, the package has not been torn, so you want to check for package integrity. You also want to check for an expiration date and whether or not it's been processed. You don't want to lean or reach over the sterile field. When you're opening a wrap, you open away from you first. Open away, then the sides, and then toward you. Peel packs, you peel them back. Flaps, don't touch the inside. When you're opening a rigid container, always make sure that the locks are in place. They have a mark on them to tell you whether or not they've been processed. When you open them, check for moisture on the inside and make sure that the filters are in place, and there is also a mark there that tells you whether or not it's been processed. Best place to open your sterile supplies ultimately is in a basin or the back table. When you're dispensing medications and solutions, you want to use a sterile transfer device. I lost my train of thought. Pour slowly so that you don't have any splashing, because splashing can cause straight through. Don't replace caps. Once you start pouring a saline or a sterile water, you shouldn't put the cap back on it and set it aside, because once the solution has been poured, that edge is considered contaminated. For people who are scrubbed in, you want to stay close to your sterile field. You should only touch sterile items, which is pretty much a given. Your hands and arms should be kept at waist level or above your waist at all times. So if you see anybody doing this, they gotta change. You don't want to cross your arms and put your hands in your armpits, and you should only be seated if the case calls for it. If you're going to be seated for the entire case, you can sit. If the case is going to be, you're going to be standing all the time for the entire case, you should not be seated at any point. And when you're changing positions, you should change positions either face to face or back to back. For people who are not scrubbed in, when walking around the sterile field, you should always face the sterile field. Don't walk between scrubbed members. Do not walk between sterile fields. We should always keep 12 inches away from a sterile field or anybody who's scrubbed in. So here's some other concerns as far as our sterility is concerned. Doors to the room should be closed at all times. Yeah, we go in and out. Yeah, we have to prop the door to get the patient in and out of the room. But once the patient's in the room, the door should be closed. Once the patient's out of the room, the door should be closed. Keeping the door closed helps with the air circulation. So when you prop that door open for cleaning or at the end of the day, the air circulation is insufficient, it's improper. Traffic should be limited. Sales reps, once they're in a room, they should stay in. They should not be coming in and out. We should not have, and I know one of my guys is just as guilty as this is some. We should not have 7 or 8 sales reps in the room at one time walking around, stirring up dust, stirring up anything in the air. Collect your items for the day at the beginning of the day to reduce the amount of times you have to go in and out of the room. When the doors are open, it disrupts the air circulation, and the amount of traffic in the room can stir up anything, and it tends to settle then on the sterile field. So what does this all mean? Well, we're the patient advocates. Doesn't matter if you're a nurse, if you're a tech. We are their last line of defense. And working as a team can help us reduce the incidence of SSI. It's through our diligence, our dedication, and our commitment that we can achieve this. Where does SSI prevention begin? It begins with us.
Thank you. That hand sanitizer you have. Here.
Susan, do you want to say anything? She has one more part of her presentation.
Already.
Okay. All right. So Melissa's going to bring up, we have a little Jeopardy game that she's going to do with you guys. While she's pulling that up, anybody have any questions about anything?
How do we get out of here? We go in between rooms, like if we take an X-ray or do the OR, how we stand in that
Sub-sterile?
Yeah, sub-sterile. Does that affect the airflow at all?
So anytime that the door opens, it affects the airflow. Whenever you open the door, it goes from positive pressure, it flips it negative, which is what kicks up the difference in the circulation there. So we do want to prevent that as much as possible.
Can we get more X-ray gowns if that's possible?
We can absolutely order more X-ray gowns.
And thyroid shots.
And thyroid shots. I know those are the first things to walk.
Question with room 6 with that kind of wind tunnel sound that it has. You know, yesterday Dr. Habib was like, is there another room we can go to? I don't want to listen to this NASCAR wind or whatever. And, you know, we propped the middle door open a little bit and it does decrease the sound. He said, I'm going crazy in here. Is there some sort of fix? Is there something they can do with the air handlers to make that sound go away? It's always there.
Yeah. Was it before construction or after construction?
It was always. Facilities is aware of it and they're looking into it.
Okay. All right.
Well, it has seemed to have gotten a little worse since the construction. Since they fixed room 5, it seems to have gotten a little worse. And I've noticed that there are some times that side door between, that leads to the scrub room will remain open because of the air current.
Oh, go this way.
I've been told in the past that we could not cover our tables and to keep them sterile because when you pull the cover off, then the edge of your drape that has covered it is coming up over the field.
So that's a
Changes
great
every other
So
year.
that's not gonna change because this drape is still gonna be coming, like how are you gonna take the drape off?
So we need to look at our current policy, which I don't know off the top of my head what it says. My guess is that it currently says we do not cover our sterile fields, we sit and monitor, because that's what our practice has been. This is a new change with AORN that's coming out in the 2019 standards. So we need to sit together as an OR and decide, is that best practice? Is that what we're going to implement? Do we stick with what we've been doing and do the one-on-one monitoring versus covering up? So for right now, do not change your practice. Continue to monitor fields once they are set up. We do not leave them unattended. And we'll revisit that once the addition of the 2019 standards come out.
And we would have to have in-servicing on that, if
Yes.
that's the
Just
case.
have to, one edge, you wouldn't let it cover all the way. You know, one edge across,
Right.
we'll just like put it right to it. Then these can all hang over and then you can just do that.
And I know you would push it back.
Yeah.
Kind of
Yeah.
put it in the
Yeah.
center and then open it like that.
And I believe the guideline that I went through recommends that they be cuffed. So you would cuff the top of it so that you can put your hands under it and take it off.
Makes sense.
There is a way sterilely, we used to do it, Karen and I
Correct.
did it years ago. You just bring it and you bring it up over top, you're not dragging it across it. So if you bring it up over top, you really can do it sterilely.
Yeah, that's why we'd have to have in-servicing, so everybody knew the right way.
Yeah, me and Carol, we used to set 3 cases up in the morning and put 2 your case you were doing and 2 other cases.
And you were just ready to go.
And you just went yeah, that's what we did for years.
What about patients that have current infections not in the surgical site? You know what I mean? For example, maybe they have, something in their urine or whatever.
Yes. So really what decides whether it's an SSI or not is all up to documentation. And even if it is an infection post-surgery, how that physician dictates his notes from that directs whether it is a reportable surgical site infection or if it is an infection that we are monitoring. And if you guys have further questions about that, we can have infection prevention come and they can talk much more on that topic than what I can do at Justice. Any other questions that anybody has?
Now your coffee.
All right, so I guess we'll just start at the beginning and work our way down. Let's start with aseptic technique for $100. All right, where's the best place to open sterile supplies when setting up for a case? Basin. Another. When are you allowed to sit for a case?
Everyone else
Case.
What'd you say?
So only if it's a sitting case.
What part of the gown is considered sterile? I heard Carolyn.
Is that sterile technique?
List 3 ways you know that an item is sterile before you dispense it to the field.
Outer wrapper's intact, the indicator is good. Ooh, I need a 3rd one. The date, I wanna go with the date or?
Expiration date.
Yeah,
Yeah,
you got it.
okay. I don't know.
What's
I'm
her
such a
thought?
catch.
That was coming your way.
That's all the expiration because I'm a coffee addict. All right, so how should unscrubbed team members move around the sterile field?
Facing the sterile field.
And?
12 inches.
I heard the 12 inches, there was one more.
Not between sterile fields.
Yes. All right, I heard a few, so. Colleen started. Ugh. Dean. And who? One over here too. I know, I'm getting wild and wicked with the candy. All right, when should nails be cleaned with the nail pick?
Before starting.
It's coming. It's bad. All right. How far up the arms do you scrub? Watch out, Berlin. It's coming. Stacy, you were supposed to catch that.
We're talking up all night.
Doesn't matter. Keep it your way. Your pocket water. That's awesome. Where should you open your gown? Not on your sterile field. Carol? Kara.
That's too far.
I didn't go that far. I'll keep it here. We'll collect it afterwards. 2 methods for scrubbing.
Stroke.
Stroke. All right. I'll try to come over here somewhere first. What's that? Here. Pass it on back. If 2 sterile personnel need to switch positions, how they do that?
Face to face or back to back?
Who was that? I heard it there first. Carol. Oh, sorry.
Grounder.
It bounced. outside?
White.
White, all right.
Red.
Not wearing what?
Somebody took mine.
I don't know if I want to throw that.
I did say one.
Pass that down. Fabric hats, can they be worn?
Yes. Covered.
If covered. Beth, I heard it.
What a ball today.
You are. True or false? Masks can be worn around the neck and saved for subsequent procedures.
Oh, false.
Jewelry may be worn if. Never for scrubs, but if it's a circulator, only if it's contained. Who wants it? Do you really want to see me throw it?
I wanna see it grow.
Yeah. It'll bounce off the wall. I'll save them up here. Come collect them after. How long should nails be, and what kind of
Millimeters.
polish?
Regular nail polish.
Regular nail polish. All right. Patient prep. So how is hair removed when necessary? All right.
With the baby pad.
Yes, free wax with every procedure.
It's good when they're still asleep. I'll wake them up.
True or
No,
false?
false.
Prep solution should be allowed to pool. True or false? Non-scrubbed personnel should apply the prep using sterile supplies. True. Where should the surgical prep start? How long should the prep solution dry? Manufacturer's recommendation. When should doors to the rooms be closed?
All time.
What percentage of SSIs are preventable?
100%. What? It's true.
Yeah. Three classifications of SSI. Alright. 3 times, just name 3 times that hand hygiene should be performed.
After surgery, before surgery.
Touching something in the environment.
All the time. Last one. Should room traffic be limited and why?
Air exchange.
Right. Alright. Final Jeopardy. Where does SSI prevention begin?
Yes.